So when you're charting teeth, it's important also to know what these other things do. In week one, it may not be that important, but every once in a while, somebody might come in with a missing tooth. Like here, this patient has no wisdom teeth, and so we deleted them out. They're not existing in this picture. But let's say the patient is missing the second lower molar. So we would click on missing teeth up here, and we'll just say it's missing, and now it's gone. Pretty simple. Or now we have to identify because we're going to put it back. So we're going to put it back here, and then we say not missing, so we can put it back. If we want to say that this is a tooth that is moved or shifted, we can just now do the same thing. So instead of missing tooth, you go to the movements, and now we would say, we would click on that and we move it forward. Now it's kind of like overrun into that area, or we can go backwards, and I'm going to click it further back so we can see, so the doctor knows that there's a gap, but that's technically tooth number 31. So we don't have to go that far or make any changes here, or we can tilt it and we can rotate it in or do whatever kind of adjustments. It's a pretty neat little tool. We don't spend too much time with that because usually the doctor knows or looks at the x-rays and sees the problem that they have to address. One other actual thing that's very helpful here is the draw mechanism. And so let's say there's something that we question here and we want to watch it. Take the pen, you click on the pen, and then you go to red. And now what we're going to do is say like, oh, we want to watch something right here. We're going to circle that here. And typically I'll even make a little W here. So it's very clear to any doctor looking at this chart that, oh, there was something there. It notifies them that this patient had a watch on that tooth for whatever reason. And maybe in the progress notes, it'll say somewhere a year or two ago. But who's going to sit there and scroll through all the treatment notes to find that one little note? So much easier when you open up the patient's chart. Let's say they have a problem on number 22. And then we look at that and go, oh, that was like 2 years ago that we put a watch on that. It looks like there's a problem, or you didn't keep it clean and now there's more decay. So that's a very helpful tool as well. But to get out of that, I still have the pen here. So you actually got to click that off and go back to pointer, which allows you to go back to here and actually click on your tooth. Otherwise, you're going to be stuck with the pointer and that kind of thing. So we're going to leave that. So that's how that looks.